Let me start with something that I tell my patients every week. Just because your blood pressure is high does not automatically mean you're doing something wrong. In fact, some of the most confused and frustrated patients that I've talked to are the ones who are doing everything they've been told. They eat well, they walk regularly, they don't smoke, they don't drink too much, and they've cut back on salt. And yet, when we check their blood pressure, it's still high. Not just once and not during stress, but consistently. That's the moment people start to feel discouraged because they were given a simple promise. Do the right things and the numbers will come down. And when that doesn't happen, they're left wondering, what am I missing? Is my body broken? Or am I just getting older? Here's the most important thing that I want you to hear right now. Those patients aren't lying, they're not being careless, and they're not failing at lifestyle changes. They're doing the right things. The issue is that blood pressure isn't controlled by habits alone, it's controlled by signals inside the body. And when those signals stay turned on for too long, your body doesn't cooperate no matter how healthy you look on paper. This is exactly what today's video is all about, because once you understand which signal is driving this, everything else starts to make sense. Most people for blood pressure control were taught a very simple model. High blood pressure equals too much salt. So naturally, people respond by cutting salt aggressively. And yes, salt does matter, but here's what I see clinically. Some people slash sodium and see big improvements, where others slash sodium and see almost no change. Why is this the case? Because for many adults, especially over 60, blood pressure is not primarily a salt problem, it's a hormonal problem. That hormone is insulin. Now, most people only associate insulin with diabetes, but insulin plays a ginormous role in blood pressure control. Every time insulin rises, it sends three important messages. To the kidneys, hold on to sodium. To the nervous system, stay slightly activated. To the blood vessels, don't fully relax yet. That's completely normal temporarily. Insulin is designed to rise after a meal, do its job, and then fall back down. The problem happens when insulin never gets the chance to fall. Let's walk through a very common, well-intended day. People will have breakfast, then a mid-morning snack, then lunch, then an afternoon snack, and dinner and an evening snack. Maybe they'll have a smoothie or a protein shake somewhere in there, and none of the foods they eat are bad, and in fact, some are excellent choices. But here's what matters physiologically. Each eating event triggers insulin. When meals and snacks are spaced too closely together, insulin never returns to baseline. Instead of rising and falling, it stays constantly elevated. This creates something I see all the time. Not diabetes, not obesity, and not something that jumps out on labs, but a state where insulin is just high enough for just long enough to create blood pressure problems. With insulin and blood pressure, the kidneys become the real problem. Your kidneys don't care whether your food was organic or homemade. They respond to hormonal signals. And insulin is one of the strongest signals that they listen to. When insulin stays elevated, your kidneys interpret that as retain sodium. Not sometimes, not briefly, but all day long. So even if you eat very little salt, even if you avoid ultra-processed foods, your kidneys are still holding on to sodium because the signal telling them to release it never comes. Think of your bloodstream like a highway. Sodium is the number of cars on the road, and your kidneys are the exit ramps. Insulin is the traffic signal that controls those exits. Cutting out salt is like putting fewer cars on the highway. That helps a little, but if the exits stay closed, traffic still backs up even with fewer cars. Chronic insulin elevation keeps those exits partially shut. So even with fewer cars coming in, congestion builds. That's why people can cut salt aggressively and still have high blood pressure. The problem isn't just how many cars are entering, it's that the exits aren't open. This also explains a pattern that many people notice, and that is my blood pressure tends to be highest in the morning. Often the reason for this isn't stress, but rather it's timing. Late night eating, even eating something healthy, can keep those insulin levels high all night. So while you sleep, the kidneys retain sodium, the nervous system stays slightly activated, blood vessels don't fully recover, and you wake up already behind. And most people have no idea that that's what's happening. Now here's where this gets even more interesting, because some of the people most affected by this phenomenon look very healthy. They're not overweight, they're active, and they look fit. This brings us to the hidden metabolic trap that no one talks about, and that is normal weight does not always mean metabolically healthy. And this is one of the most underappreciated reasons why people still struggle with high blood pressure who are skinnier. Now, there are two main types of fat in the body: subcutaneous fat, which is the fat under the skin, and visceral fat, which is fat packed around the internal organs, especially the liver. Visceral fat is the problem. It's metabolically active, it interferes with insulin signaling, and it drives chronic insulin elevation. And here's the key point: you can have normal weight and still have too much visceral fat. When that happens, your pancreas has to release more insulin just to keep blood sugar normal. So even though your labs look fine, your insulin stays elevated throughout the day, and that brings us right back to blood pressure. When insulin stays elevated, kidneys stay in sodium retention mode, nervous system doesn't fully calm down, and the blood vessels lose their ability to relax. This combination nudges blood pressure upward all day long. This is the reason that patients feel so confused. They're doing everything right on the surface, but their internal environment is working against them. I want to say this plainly to really hit this point home. The most common mistake keeping blood pressure elevated in otherwise healthy people is constant feeding. Not overeating, not junk food, not lack of discipline, but never allowing insulin to fall back to baseline. This shows up in a few very common patterns. Pattern number one is grazing all day. These are small meals or frequent snacks eating every 2 to 3 hours. This was once marketed as good for metabolism, but physiologically it keeps insulin turned on all day. Your body never enters a true low insulin state. Pattern number two is liquid calories. These are things like smoothies, protein shakes, juice, even healthy drinks. Liquid calories hit fast, and they spike insulin quickly, keeping it elevated longer. And because they don't create much fullness, people often stack them on top of meals, which makes the problem even worse. Pattern number three is late night eating. This is one of the biggest drivers of stubborn blood pressure. Eating close to bedtime keeps insulin elevated overnight. That means the kidneys retain sodium all night, the nervous system never fully downshifts, and blood vessels miss their recovery window. Over time, this resets your blood pressure baseline higher. You wake up already starting from behind. Now notice what all of these patterns have in common. It's not about what you're eating, but how often you're eating it. The main fix to all of this is to give your body time to reset. This is not extreme dieting. You don't need keto, you don't need multi-day fasts, and you don't need perfection. You need insulin low windows. That means creating stretches of time where insulin can genuinely fall. Simple examples include stop snacking between meals, finish dinner earlier, skip late night food, and compress eating into a 10 to 12 hour window. When insulin falls, a cascade of good things happen automatically. Kidneys release the sodium, blood volume normalizes, the nervous system calms down, and blood vessels relax. Blood pressure often starts coming down within days to weeks. Now, all of these things matter because chronically high blood pressure is a signal itself. High blood pressure reflects chronic mechanical stress on the heart, the kidneys, the brain, and the blood vessels. When you fix your high insulin state, you're not just lowering blood pressure, you're improving your overall health outcomes across the board. This allows you to live a longer, healthier life well into your 60s, 70s, and 80s. If you found this video helpful, consider subscribing, as it really helps push this message to the people that need to hear it the most. Finally, now that you understand why blood pressure can stay chronically elevated and fixing the signal, you're going to want to take steps to lowering it naturally and permanently. And the best way to do that is to check out the best 3 exercises for lowering blood pressure naturally. And I actually did a video on that you can check it out right here.